Welcome back to the Mountain Morning Show. I'm here with Ellen Silver, who is the Director of Jewish Family Services. So thank you so much, Ellen, for being here with us on this early morning. It's great to have you here, and we're interested in learning more about how the Jewish Family Services helps out the People's Health Clinic. So kind of give us an idea of that relationship and what's going on there.
Okay. A couple of years ago, Jewish Family Service partnered with some folks to do a support group up here for folks who are unemployed. And so we began to really see the need for also offering some counseling services. And we knew that folks can't necessarily always go to see someone privately. We offer counseling on a sliding fee scale. We're non-denominational, so we're open to anyone. And we wanted to partner somewhere where, of course, we would then not have to worry so much about a lease or rent in these tough economic times. And so we partnered with the People's Health Clinic, and we're offering them mental health service for folks who are uninsured and come to the clinic and need those mental health services, and they offer us space to see our clients. So it's really been a win-win for both of us. It's a great collaboration. We were able to hire a bilingual licensed clinical social worker so that many of their Spanish-speaking clients, patients at the clinic who would be interested in participating in some kind of counseling can now do that in a comfortable way. Great. So we've been there about 2 years.
Good. Well, that sounds like such a fantastic collaboration, and I'm sure you've seen a lot of people get some much needed help. How has that been in being involved in something like this?
We've been very, very gratified by the response to having an office up here. Certainly we've seen a lot of folks who are going through anxiety, depression, frustration around being unemployed or underemployed.
And that's such a big deal right now, of course. I feel like that's just everywhere, and you know, people are sometimes they just don't have that help. They don't really know what to do or where to go. So,
and certainly in a prolonged job search, it gets very frustrating. And in order to do a good interview, you have to kind of keep that energy up. And so having sort of a separate place where you can vent and deal with the frustrations can be very helpful. We also get referrals from the schools, so family issues, kids having problems in schools or at home. We certainly see a lot of them. New moms, you know, it's a big adjustment after you've had a child, and so we do get referrals from the clinic of a lot of new moms who are working hard to make those adjustments and have some anxieties around parenthood. And a lot of self-referrals. So a lot of people call us, you know, because they know a friend who's come to see us, and they have a family issue that they need to talk about.
And it sounds like the reputation obviously is very good. The help given and received is much appreciated, of course, with those referrals. How many of the people that come in would you say are actually from referrals?
I would say probably 75% of them, and,
wow,
and a large part of that is People's Health Clinic, which is great. I mean, the doctors and the volunteers at the clinic have been very open to this collaboration, and I think are grateful that they have a place that they can refer folks to when they see that it is not just a physical issue that someone may be dealing with, but an emotional or psychological issue as well. And Jewish Family Service has been, we've existed in Salt Lake for many, many, many years, but we never had an office up here. And so 2 years ago, when we were able to start that and kind of spread our reach more, we were really grateful for the clinic offering us space in that beautiful new building that they have at the
Yes, of course.
It was just great.
Good. And you said, I mean, obviously there's more than physical issues going on. You have mental instability, emotional things that come up. Do you have any specific examples you can share that, obviously leaving names out of situations where someone has been helped in a really good way? You
know, I think oftentimes someone will come into the clinic with some kind of physical symptom. It might be inability to sleep. It could be really debilitating headaches or stomach issues. And when the doctor talks, and I have to give them credit because those docs spend a lot of time with their patients. When they talk to them, they may then understand that beyond a physical problem, there's something emotional causing this.
So it sounds like sometimes people come in unaware that there is.
So
that happens a lot, I think.
Exactly. So they'll give our number, and within a week's time, we are able generally to get someone in. For one woman, it was a new relationship. You know, that was just, you know, she had come out of a very, very terrible relationship, was starting a new one. There was a lot of anxiety over, was she making the right decisions and choices? And again, just needing that third ear to sort of.
And can we all relate to that, whether it be with a friend or boyfriend or anything? Is this right? Should I be doing this? It's causing a lot of problems.
There's a lot of young people who come for the season and they don't have huge support systems here.
Yeah.
You know, they don't have their old friends and the people they might usually bounce ideas or confide in. And so, you know, for some of those young people, we also can help sort of be their support system.
That is really cool. I mean, I never thought of it in terms of helping young people or people that, you know, don't, like you said, have that support system. I don't know if you have stats as far as how many of those, I guess, teenagers or young college students come in. How many would you say?
You know, again, that's kind of seasonal sometimes because a lot of these young people come to work at the resorts in the ski season. You know, it's not a huge percentage, but
it's
again,
a substantial part.
Yeah, and for those folks, when they really need that, you know, I think it's meaningful to know there's an agency here.
Certainly.
And we're able to do this at no or low cost because we have funding from Intermountain Healthcare, from their foundation, and from the Park City Foundation as well, that help to support our staff person there at the clinic.
Well, that is so fantastic, Ellen. Thank you for sharing all of that. It's so good to hear about collaborations and relationships like that happening at present in the community and to hear about the help.
While I'm here and I have the opportunity, I'd love to also mention we are trying to do a lot more outreach in the community. And on March 15th, we have a lecture, community lecture that's open to the public and free at Temple Har Shalom about the 7 myths of sleep by Dr. Howard Leeman.
I should go.
You know, everyone I tell about that, I get that response, oh God, I'm definitely showing up. So it's
People don't know. Sometimes they just don't know. And so
7 o'clock, Dr. Howard Leeman from the Intermountain Sleep Center, he actually did this same lecture for us down in Salt Lake last year.
Oh, great.
And it was really well received. So I hope people will come out.
March 15th. Got that. And where is it at again?
Temple Har Shalom.
Temple Har Shalom.
At 7 o'clock.
Okay, and at 7 o'clock. So where can people, what's your website? Where can they go to find out more?
It's www.jfsutah.org, or our local number is 435-640-6697.
Very good. So people can get in touch with you if they want to learn more or to volunteer. So thank you so much, Ellen.
Thank you for having me.
For being here with Jewish Family Services. So after the break, we'll have some more interviews and our national weather for you. Like Ellen was saying, you know, go to that event on March 15th. If you're having any sleep issues, I'll probably be there myself. So anyway, we'll see you later.